Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Indomethacin. Its brand name is Indocin. Now before we talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find this information to be valuable, please consider leaving a like on the video, as it would really help me with the YouTube algorithm. So first, what will we cover in this presentation? We'll start by talking about how indomethacin works. We'll then discuss indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe indomethacin. We'll then discuss examples of dosing, and then stick around to the end where we'll talk about side effects with percentages. So how does indomethacin work? Well, it inhibits COX-1 and COX-2, which leads to decreased prostaglandin synthesis. It has anti-inflammatory, antipyretic or anti-fever, as well as analgesic properties, as in it's a pain medication. Now, in terms of indications or reasons we would prescribe this medication to a patient, we often see it used for mild to moderate pain. It can be used in the treatment of rheumatoid arthritis, as well as osteoarthritis. We sometimes see it used in ankylosing spondylitis, as well as acute gouty arthritis. With respect to contraindications or reasons we would not be able to prescribe indomethacin, we wouldn't give it to a patient who had a hypersensitivity to indomethacin or to any other component of the formulation. If a patient had an asthma, urticaria, or other allergic type reactions following aspirin or other NSAID administration in the past, they would also not use indomethacin. We wouldn't give it to a patient surrounding a CABG or coronary artery bypass graft surgery. As well, we wouldn't give it to a patient who had a history of proctitis. Now, what about dosing with indomethacin? So for mild to moderate pain, we would typically see 20 milligrams 3 times daily or 40 milligrams 2 to 3 times daily. In the treatment of osteoarthritis, the initial dose would typically be 25 milligrams orally 2 to 3 times daily, and then the patient may increase the daily dosage by 25 to 50 milligrams at weekly intervals if needed. The maximum dose would be 100 milligrams per dose or 200 milligrams per day. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using indomethacin, so I'll go over some of those here now. Less than 3% may experience abdominal pain or constipation. 1 to 3% may experience diarrhea. Indigestion may happen 1 to 9% of the time, while nausea may happen 3 to 9% of the time. Some patients may experience increased liver enzymes, and 3 to 9% may experience dizziness. A headache may occur 11 to 16% of the time, and less than 3% again may experience somnolence or vertigo. Newborn renal dysfunction or kidney dysfunction may happen 41% of the time, and a more rare side effect, less than 1%, would be hearing loss. That's all we're going to talk about today with indomethacin or Indocin. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.